Welcome, this is Dr. Paul in another episode of Ask Your Pediatrician. Today I'm going to talk to you about infants with a cough. And we're going to address primarily two topics. The first one is bronchiolitis, and the second one, croup. Parents often come in with an infant, let's say under the age of 3 or 4, and they've been coughing. And the distinction between these two illnesses is critical. The treatment is slightly different, and most importantly, you don't want to miss something that requires life-saving intervention from your pediatrician or your doctor. So let's talk about the key point with regards to when do you know it's time to come in and see the doctor. If you have a child who's breathing so fast that it's about 1 breath per second, so this might sound something like this. 1 1,000, 2 1,000. All right, that child needs to be seen right away. In fact, if your doctor's office is not open, you should go to the emergency room or an urgent care where they can handle young children. Bronchiolitis is a situation where the smaller airways are restricted, so the child can get air in easier than they can get air out. And so what you'll hear with this child is a squeaky exhale. Kind of a squeak on the exhale. Now we'll differentiate that from croup, which is an illness where you have a narrowing up here at the voice box, and those children are coming in with a croupy cough or a barky cough, and it might sound something like a barking seal. They can breathe in okay, and then they have this barky cough, and that's croup. Critical in either situation is how does your child look? If you have an infant, we're talking now, infants typically means 1 and under, but this illness can affect up to about age 2, 3, or 4, who's struggling to breathe, like I said before, breathing 1 breath every second, 60 breaths per minute, you need to be seen. Also, if you're struggling to get air, so with croup, when you have that narrowing up there in your voice box, and you're struggling, and you just can hear it, they really are struggling, maybe starting to use their shoulder muscles, their whole body to try to get air in, you can't wait until tomorrow. You need to get that child in to be seen right away. The treatment management for these conditions is quite simple. Once you've seen a doctor at a doctor's office, in the more severe cases, we can check your child's oxygen, make sure they're actually oxygenating well enough. Of course, we can listen to the lungs with a stethoscope and make the determination quite easily whether we're dealing with a wheezing type bronchiolitis illness or a croup, narrowing of the upper airway. The management of bronchiolitis, for example, if you've got a severe narrowing of these airways, is much like that with asthma. We will try bronchodilators. You may have heard of albuterol, Zopanex. These are medicines that can be used to dilate the little tiny airways in the lungs, and this can be very helpful. In the most severe cases, if your child needs to be hospitalized, we'll actually give children oxygen to support them until those airways open up. In the case of croup, where you have that narrowing up in this area, the treatment is often a steroid. This can be given orally. Sometimes some doctors will choose to inject this steroid. A steroid is a very potent anti-inflammatory medication, and really you're treating the inflammation that's happening in the voice box. And so once that happens, sometimes for a steroid to take effect, it can take a few hours. So you don't want to wait until your child is in extreme severe distress to seek help. But on the other hand, don't let the barkiness of a child's croupy cough alarm you. Almost all kids who get croup will have a barky cough, and it doesn't necessarily mean they're in trouble. With the croupy cough, it can sound a lot worse than it actually is. So you need to have a sense of how hard are they working? Do they seem troubled themselves, or is it just a minor nuisance or annoyance? So in summary, to wrap it up, if you have a child who has a croupy, barky cough, and they seem to be struggling in any way or a little bit stressed out, anxious, have that child seen. We can help you determine if they're bad enough to need steroids, or in very severe cases, very rarely, to be hospitalized for oxygen support and some other management approaches that can be done in the hospital. If you have the bronchiolitis infant who's got that squeaky, rapid breathing, squeaky exhale, again, remember, if they're breathing close to 60 breaths per minute, 1 breath per second, you've got to have that infant seen. Their condition is treatable and absolutely not dangerous if seen, evaluated, and if they're bad enough to need hospitalization, we're going to give them oxygen support until the medication either kicks in or the illness runs its course. I should make a point of mentioning that both of these particular illnesses are viral. So there are a number of viruses that can cause croup. We tend to think of it as a para-influenza virus, but other cold viruses, influenza itself can cause that narrowing in the throat, which would give you the croupy cough. With regards to bronchiolitis, this is usually caused by RSV, respiratory syncytial virus. But again, it is possible to have a bronchiolitis-like illness triggered by different viruses. So remember, parents, with viruses you do not need antibiotics. We basically need to support the child. If they need their airways opened up with a bronchodilator, such as the albuterol mentioned for bronchiolitis, that might be used. If you have croup with severe narrowing of the throat, we might use an oral steroid or an injection to, again, decrease the inflammation and allow them to breathe better and get enough oxygen. Thank you for watching, and remember, I'm your pediatrician.